Hi, I'm Dr. Matt Sheehan, Medford Family Chiropractic Center, Medford, Oregon. And I'm here today to demonstrate a little about ergonomics. In my practice, I use this particular sheet. Where I got it through the years, I have no memory, but it's a fantastic sheet for just discussing workplace ergonomics sitting at a computer desk. And just so you know, for you men, the skirt part is optional. You don't have to wear a skirt. And so what I wanted to do is just do a little demo of some of the details, because the devil's in the details, and show you what some of the finer points are in here that are so critical. And I spend a lot of my time during my day going over these points for patients who sit at a desk. So one of the major points that I always make to my patients is that it doesn't matter what work a chiropractor, physical therapist, massage therapist, acupuncturist does on any set of patients if critical factors like this are not addressed and straightened out. I've noticed through the years that if a patient gets a treatment from me or somebody else and then they go right back to their workplace horrible posture unbeknownst to them, and they start out sitting up nice and straight and tall at 8 o'clock in the morning like this, and they're typing, and then all of a sudden within an hour they're kind of settled in and they're kind of like this, or they're like this, or like this, but especially like this, or the keyboard is too high or the chair is too low. But if they're doing some version of this, there goes the treatment. It didn't do them any good in the long run. So we really need to clear up the majority of these points on here, which are really well delineated. The first and the most important of which probably is the height of the chair. So you really want the chair height to be great enough so that your knees are slightly lower than your hips, if you can. So an adjustable chair is a great thing. And often at a workplace, you're in a place where you might be sharing the desk with other people who work there at different times of the week. So you may not have a lot of ability to customize it to your individual needs. But if you can, it's really helpful to do so. The chair is a big part of that. So you want it high enough so that your knees are slightly lower than your hips. And the reason for this is just that, watch what happens. See, if my knees are lower, if I lower them all the way down by bringing my feet back a little bit under my hips, I drop my knees down, what happens is the curve in the small of my back will be maintained without me having to hold myself rigidly in this posture. I can totally relax and keep some semblance of a curve in the small of my back. Now watch what happens to that. I'm totally relaxed right now and I have a decent curve right here. Now if I lower my chair so that my pelvis is at the same height as my knees or is even lower, watch what happens. Okay, I'm going to go down here. My pelvis is just about level with my knees. Now I'm holding myself up rigidly. Now watch what happens when I relax to the same degree I was a second ago. Watch. See what happened? Look at the whole spine. I went from curve in the small of my back, curve in the upper part, which is a decent curve, to just a C curve all the way along my whole back. I just slouch forward. My shoulders come forward, my chest compresses. I'm not going to be able to breathe as well, get aeration into my brain. I'm going to get sleepy. Now watch what happens to my head. I go from straight, where I'm looking straight ahead, my neck has a decent curve, to that. See, my head tips back, and my shoulders slump down, my head comes way forward. Horrible posture for my neck, for my mid-back, my low back. All that's going to start aching and spasming, and it's not going to be good. So, first thing again, chair to the point where the hips are a little higher than the knees, if you can do it. And then obviously that necessitates the desk has to be at the right height to match where you are with the chair. Now, the height that you want, the desk situation, the most important part for most people is where the keyboard and the mouse are, obviously. If you can, it's often helpful to have the keyboard and the mouse on one of the slide-out trays that we see a lot of people using. And the reason is because that allows you to have your wrist level with your elbow, or even a little lower. Ideally, it's even a little lower. And if you can slide that tray out towards you, the ideal position for your elbow is to have it right under your shoulder. So see that on here. You can see her elbow is right under her shoulder. Her wrist is pretty much level with her elbow, and her knees are slightly below her hips. Okay. So the reason you want your wrists lower than your elbows is because if they're up here, if the desk is way up here, and you do this, what you're going to do to compensate, to bring this relationship back unconsciously, is you're going to shrug your shoulders. You're not even going to notice. The only thing you're going to notice is 20 minutes after you start working, you go to turn your head, and your head feels like it's going to fall off because you get this stinging, nasty, burning pain in the tops of your shoulders because they're exhausted from holding your shoulders up like that. You don't even notice it until you go to move. Okay, so to keep from doing that, you can keep your shoulders down if you keep your elbows under your shoulder and keep your wrist level at or lower than your elbow. Okay, and the other mistake people make is if they have their arms way forward. This is huge. So many people have their arms way forward like this and they're typing like this. That rounds your shoulder blades forward like this, and what that does, I can feel it already, that what it does is it stretches those muscles between the shoulder blades and makes them weak, makes them work too hard, and they spasm, and then they start to cramp, and then you get problems between the shoulder blades. It also tends to lock your ribs. That's going to lock your ribs and pop them out on you posteriorly. A lot of them, you have a whole row of them on both sides that are just totally rigid and locked, causing lots of problems. So you don't want to do that. You want to have them here, and you want to have them low enough. They don't have to be on a slide-out tray. It's just helpful. If you have the desk at the right height, you don't need it. Okay. The next thing that we see here on this sheet, you'll notice she's looking straight ahead, and you want the top part of the visual part of your monitor to be level, if possible, with your eyes. That's really important if you're spending an 8 or 10 hour day sitting at a desk. If you're looking down, as I am here, at a laptop, so a lot of people have this problem at home, if they're at home doing work or fooling around with a laptop, you'll notice I'm looking straight down at this thing. Look at my neck curve. It goes from curved like this to reverse like this. For every inch that your head is forward of the midline of your body, for every inch that it comes forward, it adds 60 pounds of torque on these neck muscles. Okay, so if you're at work and you're looking down, the monitor's down there, it's not up on a stack somewhere, you're looking down, that really strains these neck muscles and it causes lots of problems. It also tightens up these front neck muscles, which I showed recently how to stretch. So look for another video for how to stretch these. So you want to take your monitor, put it up on a stack of phone books, and that's mostly what phone books are good for these days, right? Most of us don't use them anymore. Great, put them under the monitor, jack that sucker up so the top of the visual part is level with your eyes. Okay, so the next point I want to make is about how to use a laptop at home or at the office ergonomically correctly. If the laptop is down here, I'm typically going to be leaning forward and looking down. Horrible posture, we already talked about that. So what we really want to do with this is we want to make this into a desktop. So in order to make a laptop more of an ergonomically useful piece of equipment, what we need to do is go out and buy an inexpensive supplemental keyboard and mouse. You can pick them up at various stores. They're pretty inexpensive, $15, something like that. You can also get cordless ones that are great. And so what you're going to do there is you're going to situate the secondary keyboard and mouse where we said the desktop computer one should sit. And we already talked about that. So we want that right here, so the arms are positioned here. And then that allows us to essentially just use the laptop itself for the monitor. So we'll position the laptop now up here so that the top of the visual part of the monitor, again, is level with our eyes. We're not using this keyboard at all. We're using the supplemental one down here. And you also want the distance. Think about this. You want the distance from you to be dialed in so that you're not having to squint and look forward at it. So try and position this close enough so you get a really good view. All right, so you can keep your head in neutral position, not like this and going like this and all that, which will really mess up your whole posture. So they're close enough and at the right height. Okay, next thing I want to talk about is some cheapo chair solutions. Some of us have chairs that are really lousy. They don't go up high enough, or they're not very adjustable. Armrests are another really nice feature if they're adjustable and they're at the right height. If they're not, sometimes we'll tend to screw it up by, if they're too low, we'll sometimes slouch in order to get our arms down on the armrest, or over like this or something while we're doing one hand like this, or the mouse like this. That's not not a good thing. You're better off not using the armrests at all if they're not in the right place. But if you can adjust them to the right height, so you're good here in your posture and your arms sit on them and they're relaxed, and these are relaxed up here, great. By all means, use them. Now, so we have some inexpensive solution for some problems for certain chairs here that I want to talk about. So one thing is a wedge. It's a foam rubber wedge, and this one goes for, I sell this in my office, $15, and you can sometimes get them in fabric stores, a wedge like this. Might be able to pick them up for a couple bucks. Most chiropractic offices have them or can order them. So the beauty of this is, you see it's a wedge, thicker in the back, thinner in the front, and what you do is you sit on it with the thick part under your pelvis, and you'll notice what it does is it raises the hips higher than the knees, so you get this slant effect. And the beauty of this is it adds a little height if the chair is too short, and it increases that angle here so that when I, again, completely relax, I'm slouching a lot less. I don't have to muscle my way through the whole day where I'm holding myself up, because that can get exhausting too. So the less you have to try or think about it, the more you can devote your effort to your work. So a wedge is a good situation for some people. A lot of people don't like these things because they tend to slide off them or they're uncomfortable. But for the people that they're comfortable for, they can be a godsend. Okay, so the next thing I want to discuss about the optimizing your ergonomics sitting in a chair at work or in a car or at home is this company is called Back Hugger. This is just one of many, but it's basically, this is one I use in my car, but it's the same theory we use in a desk situation. And so what we do is we just place it behind the back here in the curve of the back, and it augments the curve. It makes it a little greater. And if you're sitting back using the backrest on the chair, which we should ideally all be doing, what it's going to do is just hold you in a curved position without you having to think about it. So it optimizes that piece for you. So that also reminds us to not sit forward where we're essentially just using the chair as a stool. You don't want to do that. It puts a lot of weight on the discs and doesn't do good things over the years. So you want to use the backrest. It takes a lot of the pressure off your back, and you want to idealize that curve. These kind of pillows run typically $35, and these will last 10 years. They're great. You just want to get the right one. They have ones for secretaries. They have broader ones, narrower ones, more curve, less curve. They have ones for autos, that sort of thing. So just ask your chiropractor. So next thing I want to mention is what we see here in this diagram is that this gal's legs are kind of on an angle here, and we see this little 2-inch gap there. What that's demonstrating is that when we're sitting in a chair, what we ideally want to do is make it so that if the chair is long this way and it's coming up against your knee, the back of your knee, if your legs are straight down, it might cut off the circulation to your lower leg and cause varicose veins and blood pooling in your ankles, that sort of thing. Not very healthy, not very attractive, obviously. So how we get around that is you may need to have your legs less bent at the knee, so your legs are straight out a little more, maybe another 20 degrees, and you can get like a little box or something that you could put your feet on to rest them on, to keep your legs out there, especially if the chair angle here is such that your legs are almost dangling. You may want to rest it on something there. So that'll help the circulation. Okay, those are all the points I wanted to make about ergonomics, sitting at a desk, and let us know if you have any questions about that. Thanks.